From Vermont Public, this is The Frequency. I'm Mitch Wertlieb. It's Monday, August 11th, and here are today's headlines. Some people who receive benefits from the Supplemental Nutrition Assistance Program known as SNAP are criticizing the state for sharing their sensitive personal information with the Trump administration. Vermont's Agency of Human Services confirmed it sent the data. It affects about 140,000 low-income Vermonters. Lori Weber is a SNAP recipient who lives in Westminster. She says she had a visceral reaction when she found out that Republican Governor Phil Scott authorized the transfer.
Anger and shock that Scott would do that. I mean, what? Why? I felt vulnerable, exposed.
Scott says Vermont could have faced financial sanctions if it didn't comply with the Trump administration's demand for information. But Scott's critics say he should have joined a multi-state lawsuit that seeks to block the federal order. Brattleboro Memorial Hospital has lost nearly $9 million over the past year, and officials there are working to create a balanced budget going forward. They've presented that budget to healthcare regulators at the Green Mountain Care Board. The hospital has had a hiring freeze in place since April and cut 6 administrative roles this summer. Laura Bruno is the chief financial officer.
So we fully recognize that we are in a very bad financial condition, and we are taking a lot of actions to establish sustainability for the future of this hospital.
Bruno says the hospital risks losing millions of dollars because of uncertainty about a variety of federal programs, including one that allows it to purchase drugs at a discounted price. Healthcare regulators will decide whether to approve proposed hospital budgets by mid-September. Housing advocates are urging some people who were forced to leave Vermont's motel voucher program to send appeals to the state's Human Services Board. That's because Vermont Legal Aid says it's prevailed in an emergency housing case against the Department for Children and Families. The dispute centered on how the department was calculating new 80-day time limits for unhoused residents using the state's motel program. The Human Services Board ruled in Vermont Legal Aid's favor last Thursday. It concluded that only days in the current fiscal year count toward the limit. That decision could buy more time for some residents who were forced to leave the motel program. And Governor Phil Scott says he's developing a plan to bring a sizable number of state employees back to work in downtown Montpelier. Many state employees were required to work remotely at the start of the coronavirus pandemic in 2020, and as of last year, the administration estimates about 40% of Montpelier's roughly 2,500 state workers were still remote at least 3 days a week. Scott says remote work doesn't always yield the best results, and he expects to release his new plan in several months.
And it won't be back full-time. We'll still have remote work for some, but I think we'll get the best results from bringing back people into the office so they can interact with one another.
Montpelier business leaders have cited fewer state employees working in person over the past 5 years as a major reason why some retail stores are experiencing severe economic difficulties. Coming up, after 4 years serving as the head of Vermont's Department of Corrections, Nick Demmel is stepping down from the job. He spoke with Vermont Public's Liam Elder-Connors about what changed under his leadership and the state of the state's prisons now as he prepares to leave. That's after this. Nick Demmel took over the state prison system after spending 7 years at the CIA. He'd never worked in corrections before and was tasked with navigating the pandemic, reforming a toxic workplace culture, and addressing an acute staffing shortage. Demmel will step down on Friday after nearly 4 years on the job. Vermont Public's Liam Elder-Connors spoke with Demmel about his time in charge of the state's prison system, and he started by asking Demmel about the current state of the Department of Corrections.
Philosophically, I think we align the department back to its people. So the folks who work here every day, the public servants that are working in our 6 correctional facilities across the state, in our field offices, and the people who live there, the folks who are incarcerated there. And with that philosophy shift, kind of reset, it enabled us to then do things for those populations. So we've driven our vacancy rate down to 15% today from a high of 32% vacancy rate among our security staff. That was a huge success story, and 15% isn't good enough. We got a long ways. We want to keep pushing that. We provided free community college education to our staff through a program with CCV and to our incarcerated population. I think we reoriented the department on health and healthcare, and really trying to understand that people will be more successful when they leave our system if they leave healthier than when they came in. And for many of those folks, we're the first place they get access to primary care, the first place they've gotten access to consistent substance use treatment and recovery supports. So we have a lot of opportunity to help people when they're at their lowest and help them leave better than we found them.
We've talked over the years as there was an uptick in deaths in the prisons, and there were some allegations that the medical contractor had provided inadequate care in at least one case. Do you think the issues that cropped up there have been addressed adequately? And if not, where do you see some places that need some more work?
Yeah, I think that this has been, for me, one of the most vexing parts of running the correction system is you're not only running a facility where people are housed, you're also running a hospital system on top of it. And I think in many ways we have improved our work in that space. We've spent a lot of time reviewing adverse incidents and understanding what went wrong here? How do we improve that system for the future? And there are a few projects underway to continue to study that in different ways so that we can really continue to move. In Vermont, we contract out our health services, continue to move the contractor towards what we want. I do think we've seen an improvement in care in the last few years, and so that's great. But certainly, this work will never end, and I don't think we're where we want to be yet. And that's a continued evolution that we are moving through.
I want to talk a little bit about the staffing issues that you've had. It's been called a crisis, obviously, and it's gotten worse. What do you think is needed to really address that problem? I think you talked to my colleague earlier this year where he said you kind of hit a ceiling when it comes to boosting pay, that the conditions are almost more the problem now. So how do you address that?
We did. We raised pay about $30 million in the last 3.5 years or so. And I think that was appropriate. I can't tell you how hard, having seen it in person up close on a near daily basis, can't tell you how hard the staff in correctional facilities are working. At the same time that they're saying, this is really hard work and the pressures are too much and I don't know how much longer I can do this, they say, but I wish I could because I love this work and I want to keep doing it. So that's a really tough spot to be in as an administrator, trying to figure out how to reconcile this. But some of the things we've tried to do are to improve the facilities, to create space where staff have time to just recuperate, rest. Looks a little different than the rest of the facility. We've worked on rolling out staff wellness programs. We have a peer support program. And all of that taken together is still not enough.
What's next for you? I think you said, let me just get the wording right. You were going to start an advisory practice. Is that a consulting firm? What does that look like?
Yeah, I think, I'm still in this job, so I don't want to get too far forward on my skis, but I think that there's some things that I see in the correction space, in the public safety space, and in my old area, national security space, where I think I can make a difference and help move the needle further by either helping states or the government more broadly, helping organizations who are working in this space to continue to move in the direction that I think is important. And so I'm going to go do some of that work and excited to take that on in about 2 weeks.
Are you planning on running for political office?
That question has come up quite a bit lately. I am not planning in any way to run for political office, so hopefully we can put that one to bed.
That was Vermont Public's Liam Elder Connor speaking with Nick Demmel, who's retiring as the head of Vermont's Department of Corrections. Thanks for listening to The Frequency today. We had additional reporting from Peter Hirschfeld, Lexi Kropp, Alicia Fries, and Bob Kinzel. Today's episode was edited by Stephanie Colombini, and our music is by Blue Dot Sessions. I'm Mitch Wertlieb. Talk to you tomorrow.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.